The topics and opinions expressed on the following show are solely those of the hosts and their guests and not those of W4WN Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4WN Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4WN Radio.
Books, beauty products, science, fashion, and glam talk. From Bollywood to Hollywood, it's Dr.Afshan Hashmi's radio show every Wednesday at 6 p.m. Eastern Time, right here on W4WN Radio, the Women for Women Network. And here's your host, international speaker, educator, award-winning entrepreneur, and best-selling author, Dr. Afshan N. Hashmi.
Hello everyone, this is Dr. Afshan Hashmi live from the Florida studio of W4WN Radio and Talk for TV. And friends, I just wanted to remind you first that please go and buy these two books. These two books were Amazon bestsellers, and if you buy these two books, I finance these shows through that, because to make these kind of shows requires lot of money and energy. So please go and buy these two books and give me an honest review. Having said that, friends, I will request you to give me sponsorship, because this show is syndicated worldwide to 300 million listeners. And if you give me sponsorship, just think how your product will be promoted in such a grand way to 300 million listeners. And you write to me at afshan at drafshanhashmi.com, and I will give you a very reasonable price. Having said that, I will request my sound engineer Jason to please play the first sponsorship movie. Hello everyone, this is Dr. Afshan Hashmi live from a barn in Virginia, and I just wanted to say for my W4WN Radio and Talk for TV, I request everyone who is listening to please give a sponsorship if you want these shows to continue, because this show is syndicated worldwide to more than 300 million listeners. So if you give me sponsorship, your product will be promoted to more than 300 million listeners around the globe. And I wanted to tell you that to make these kind of shows, it requires lot of money and energy. So I just want to request a sponsorship, and cheers and bye bye. So today I will read and review a book, written by the former FDA commissioner, and this is the beautiful cover of the book, and it says Uncontrolled Spread: Why COVID-19 Crushed Us and How We Can Defeat the Next Pandemic, by Scott Gottlieb, MD, former FDA commissioner. So please see such a beautiful cover of the book. And now I will read about the book. Physician and former FDA Commissioner Scott Gottlieb asks, has America's COVID-19 catastrophe taught us anything? In Uncontrolled Spread, he shows how the coronavirus and its variants were able to trounce the America's pandemic preparations, and he outlines the steps that must be taken to protect against the next outbreak. As the pandemic unfolded, Gottlieb was in regular contact with all the key players in Congress, the Trump administration, and the drug and diagnostic industries. He provides an inside account of how level after level of American government crumbled as the COVID-19 crisis advanced. A system wide failure across government institutions left the nation blind to the threat and unable to mount an effective response. We had prepared for the wrong virus. We failed to identify the contagion early enough and became overly reliant on costly and sometimes divisive tactics that couldn't fully slow the spread. We never considered asymptomatic transmission, and we assumed people would follow public health guidance. Key bureaucracies like the CDC were hidebound and outmatched. Weak political leadership aggravated these woes. We didn't view a public health disaster as a threat to our national security. Many of the woes sprung from the CDC, which has very little real time reporting capability to inform us of COVID twist and turn or assess our defenses. The agencies lacked an operational capacity and mindset to mobilize the kind of national response that was needed. To guard against future pandemic risks, we must remake the CDC and properly equip it to better confront crisis. We must also get our intelligence services more engaged in the global public health mission to gather information and uncover emerging risks before they hit our shores so we can head them off. For this role, our clandestine agencies have tools and capabilities that the CDC lacks. Uncontrolled spread argues we must fix our system and prepare for a deadlier coronavirus variant, a flu pandemic, or whatever else nature or those wishing us harm may threaten us with. Gottlieb outlines policies and investments that are essential to prepare the United States and the world for future threats. Now I will read about the author Scott Gottlieb. Dr. Scott Gottlieb served as the 23rd Commissioner of the U.S. Food and Drug Administration and is a resident fellow at the American Enterprise Institute. He is a regular contributor to the business news channel CNBC and a partner at the venture capital firm New Enterprise Associates. Dr. Gottlieb serves on the board of directors of the pharmaceutical company Pfizer Inc. and the genomic sequencing company Illumina Inc. Fortune magazine has recognized him as one of the world's 50 greatest leaders, and Time magazine has named him one of its 50 people transforming healthcare. A graduate of Wesleyan University and the Mount Sinai School of Medicine, Dr. Gottlieb is an elected member of the National Academy of Medicine. He lives with his family in Westport, Connecticut. And now, friends, I will go on a break, and when I come back, I will read from the book.
Would you love exposure for your business, product, or service to over 300 million potential listeners? Send an email to info@talkformedia.com. And now let's hear from some of our sponsors.
Chapter 2: How Jugaad leads to multi-sector success stories in India, including definitions of the Jugaad management principle business model. Of the book, The Modern Mughal Mentality, New Strategies to Succeed in India and the Global Marketplace. Inspiration. True Jugaad is an inspiration on how to create products using technology that meet the price-value equation. According to a Harvard Business Review article featuring expert Prahlad and Mashelkar, most innovation programs are built on the assumptions of affluence and abundance. We see the rich and the young in both the developed and the developing countries demanding environmental friendly products and services. They also believe that affordability and sustainability are crucial to driving successful business today. New technologies and radical business models are important not only to penetrate mass markets in India but in the entire world. By reconfiguring all areas of the business structure, they will pull.
A monstrous infection is spreading worldwide. OMG, is this a simple infection or a deliberate attempt to ruin the human population? Or maybe it's bioterrorism. What is this global infection and who is spreading it? Help us find out. Go to Amazon and search for The Outbreak of a Monstrous Infection. The human race needs your help to make this go viral. Go to Amazon.com and read The Outbreak of a Monstrous Infection to find out what happens next.
Go now! The world is depending on you.
And now, back to Dr. Afshan Hashmi's radio show.
So, friends, before starting to read from the book, I will request you again to please go and buy these two books. And these two books were Amazon bestsellers. And through the sale of these two books, I finance these shows. As you know, that producing these kind of shows requires lot of energy and money. So, if you want these shows to continue, please go and buy these two books and give me an honest review. The first book is The Modern Mughal Mentality, New Strategies to Succeed in India and the Global Marketplace. And this talks about Jugaad, a Hindi buzzword. And when this book came, there was a lot of research going on in Harvard and Stanford on Jugaad, and I have conceptualized Jugaad as thinking outside the box. And there is a business model, and if you follow this business model and the case studies here, you will be very successful in business. So please go and buy this book and give me an honest review. The second one is The Outbreak of a Monstrous Infection. And when this book came in 2019, there was no trace of coronavirus, and I have in a very unique story conceptualized how a virus can spread and ruin the human population as coronavirus has done. And you will love this story because I have beautiful reviews on Amazon, and you can go and read it. And please go and buy these two books and give me an honest review. And also, I will request to please give me sponsorship, as these shows are also financed by sponsorships, if you want these shows to continue. So please give me sponsorship, and I will give you a very reasonable rate if you write to me at Afshan at drafshanhashmi.com. And also, I will request Jason, my sound engineer, to please play the second sponsorship film. Hello everyone, this is Dr. Afshan Hashmi, and I just wanted to request you that please give me sponsorship. And I am live from Maryland, and this show is syndicated worldwide with more than 300 million listeners. And to produce these kind of shows, it requires lot of time and money. So please give me sponsorship if you want these shows to continue. And I'm live from Maryland. Having said that, friend, cheers and bye bye. So this was the request for sponsorship my shows, and you can write to me at Afshan at drafshanhashmi.com. Now I will start reading from this beautiful book, and you can see the beautiful cover and the author's name. And now I will read first the introduction. And here is the introduction, little bit from the introduction. In New York City, fourth year medical students at New York University Grossman School of Medicine were given the option of graduating early if they agreed to work on the hospital's COVID wards. It was an airy throwback to events that unfolded 100 years earlier during the Spanish flu, when Philadelphia, critically short of healthcare workers, pressed medical students into service. In March 2020, it wasn't only medical students who were thrust into improbable circumstances. New York City had become the initial epicenter of the COVID 19 pandemic in the United States. In its hospitals, surgical residents were running makeshift intensive care units that were fashioned out of operating rooms. Pathology residents were reassigned to the medical wards. The Federal Emergency Management Agency, FEMA, which responds to national disasters, was asked to send 85 refrigeration trucks and personnel into the New York City Medical Examiner's office, where there was a desperate need for burial services to help manage a cascade of dead bodies. To bolster its normal mortuary work, New York City added more than 200 soldiers and airmen from the Army and the National Guard. New York State had issued a jarring directive urging EMS crews and other emergency service workers to forego attempts to revive anyone without a pulse when they got to the scene of a medical emergency amid the intolerable strain caused by COVID surge. Running short on ventilators, New York Presbyterian Hospital made the extraordinary decision to retrofit its breathing machines with 3D printed plastic tubing that allowed doctors to ventilate two patients simultaneously using the same device. So this was little bit from the introduction, and now I will read from chapter 1. And here it is, and it says, America the vulnerable. I'm not saying we are at the edge of a pandemic, but the problem is it's hard to tell. I'm not saying this will spiral worse, but it could, and it represents an existential risk. Those were two messages I sent on Saturday morning, January 18, 2020, to Joe Grogan, the head of the Domestic Policy Council in the White House. Grogan and I had worked together at the Food and Drug Administration (FDA) in 2005 when I served as the agency's deputy commissioner. Now he was running the domestic policy portfolio for the President of the United States. I had also worked at the FDA in 2003 when the nation was still grappling with the SARS-1 outbreak. I returned as the agency's commissioner in 2017 at the start of the Trump administration and served in that role until April 2019. Over my time serving in different federal public health roles, I had seen these threats come and mostly go, but this new virus looked ominous. A mysterious pneumonia was spreading in the Chinese city of Wuhan, and from the sketchy accounts, it was making people very ill. I was worried. I knew that reporting from China was unreliable, and the details we had could be just a small shard of what was really underway. That had certainly been our experience with SARS 1, where the initial reporting on the outbreak was dangerously incomplete. Much later, we would learn that the Chinese government had withheld material facts about the scope of its SARS 1 outbreak from global health authorities on from its own citizens. The events unfolding in Wuhan worried me for other reasons. One was the velocity of the spread of this new infection. Chinese officials initially reported just a dozen known cases. Now, a few days later, on the morning I reached out to Grogan, the case count had quadrupled overnight to 198 patients. Seeing the news early that morning, I had confirmed with scientific colleagues in the US and Australia on new reports that most of the patients in China were severely ill. I texted to Grogan that he ought to make sure the administration's health team was coordinating response to Wuhan. I suspected that whatever the case numbers were, the actual scope of the outbreak could be much larger. Chinese health officials were saying that the source of the infection was an unspecified animal that had been sold in a local market where many of the cases had allegedly originated, but some of the new cases had no discernible links to that market. The notion that one outdoor food market was the site of the spread and that the origin was a single zoonotic source seems to be unraveling, and yet Chinese officials were still clinging to this theory. The US Centers for Disease Control and Prevention already had evidence in the form of clusters of cases that occurred in the same families to suggest that the virus was spreading between people. Yet, several days earlier, on January 14, the World Health Organization, who relaying China's assurances, tweeted that there was no clear evidence of human to human transmission. I could be wrong, but I would be surprised If China has shared actual virus, it will make developing screening tests harder. I texted to Grogan, asked HHS for a briefing. I suggested adding my worry is it looks humanized, it looks human adapted, but it's very hard to tell. Joe Grogan was among the handful of White House officials who were focused on the virus early, and he was appropriately apprehensive of the potential danger it posed. Acting on our exchange that same day, he contacted the Department of Health and Human Services (HHS) and asked that briefings be set up for Monday, January 20. He also reached out to the CDC and discovered that lower level conversations had already begun between that agency and the National Security Council. Direct engagement from the head of the Domestic Policy Council this early in a public health crisis was not typical, but it fit the playbook during the Trump administration, one that emerged partly as a consequence of a perception that voids had been left by some of the administration's top health officials at the Department of Health and Human Services in responding to earlier outbreaks of dangerous viruses. In 2019, the Domestic Policy Council had helped organize the response to an outbreak of measles, and the previous year it had been involved with the response to a large cluster of cases of a mysterious polio like illness that was causing paralysis in children. Flaccid paralysis, as it came to be called, was later attributed to an epidemic caused by an entovirus EVD68, one of a family of viruses typically spread by touching surfaces that have been contaminated by an infected person and touching one's mouth, nose, or eyes. Illnesses caused by enteroviruses are usually mild, but if the virus infects the central nervous system, which happens in rare cases, it can cause serious illness. A spike in cases of acute flaccid myelitis, where the enterovirus directly infects the motor neurons of children or causes these nerve cells to become inflamed, had occurred in 2014, and a bigger spike reoccurred in 2018 with 138 confirmed cases in 42 states. The children around 5 years old on average had previously been healthy. In most cases, they would report having a mild respiratory illness a week before the weakness started. Months later, many were left with some disability. Nobody knew why the infections were suddenly causing the syndrome or how to prevent them. So this was little bit from chapter 1. Now I will read little bit from chapter 2, and this is chapter 2. Chapter 2, Confusion and Subterfuge. Why Guasgian would get sick around the same time every winter, working as a merchant at Wuhan's Hunan seafood market where she sold shrimp. She caught a lot of colds. Her symptoms started the usual way, but this time they quickly worsened. With increasing congestion, she went to a local clinic where she was given an antibiotic and sent home, but overnight her condition deteriorated. So the next day she visited Wuhan's 11th hospital in search of more care. Again, she was sent home. The doctor at the 11th hospital could not figure out what was wrong with me and gave me pills, she would later tell a Chinese newspaper, but the pills didn't work either. 5 days later, she went to Wuhan Central Hospital, one of the region's busiest medical centers, with more than 3,000 patient beds and employing about 4,000 providers and staff. Was now gravely ill with severe pneumonia in both her lungs and was admitted to intensive care. It was December 15, 2019. V was told by the doctors that her illness was ruthless. They were seeing patients with similar symptoms who had also frequented the nearby Hunan market. Many of the patients, like we, were in severe distress. The market was located in the Jing'an district of Wuhan, a city of 11 million and the capital of China's Hubei province with its 653 stalls. It was a bustling outdoor food bazaar, popular for its live animals and wholesale seafood. Like the other patients at the Wuhan Central Hospital, V was at first screened for common respiratory viruses, but the tests all came back negative. Something novel was making her sick, and by every measure, it was spreading among the city's residents. By December 21, local doctors counted at least 3 dozen hospitalized patients. Many were seriously ill and had matching symptoms. Unable to identify the cause of the menacing illness on December 24, the doctors at Wuhan Central Hospital, where V was now critically ill, took fluid from the lungs of another patient with similar symptoms and sent it for deeper analysis. He was a 65-year-old delivery man who also worked at the seafood market and was first admitted to the hospital on December 16. A CAT scan showed extensive infection in both of his lungs, even though, as with V, a standard battery of tests for known viruses and bacterial infections has also come back negative. Doctors tried prescribing a milieu of antibiotics and antiviral drugs, but the medicines didn't help. With his condition declining, doctors sent his sample to Vision Medicals, a genomics company in Guangzhou. They needed answers. They needed to find the cause of the contagion. Vigil's Medical offers genetic sequencing directly to doctors. The company can read the genetic code of the individual pathogens that it finds in a patient's body fluids to try to isolate the virus or bacterium that was causing the illness. By combing through all of the viruses found in the man's sputum, Vision's Medical sought to determine if he was harboring a novel pathogen. So this was little bit from chapter second, and now friends, I will go on a break, and after I come back from break, I will give you my thoughts and review on that, and if the time permits, then I will read little bit more from the book.
Would you love exposure for your business, product, or service to over 300 million potential listeners? Send an email to info@talk4media.com. And now let's hear from some of our sponsors.
Chapter 2: How Jugaad leads to multi-sector success stories in India, including definitions of the Jugaad management principle business model. Of the book, The Modern Mughal Mentality, New Strategies to Succeed in India and the Global Marketplace. Inspiration. True Jugaad is an inspiration on how to create products using technology that meet the price-value equation. According to a Harvard Business Review article featuring expert Prahlad and Mashelkar, most innovation programs are built on the assumptions of affluence and abundance. We see the rich and the young in both the developed and the developing countries demanding environmental friendly products and services. They also believe that affordability and sustainability are crucial to driving successful business today. New technologies and radical business models are important not only to penetrate mass markets in India but in the entire world. By reconfiguring all areas of the business structure, they will pull.
A monstrous infection is spreading worldwide. OMG, is this a simple infection or a deliberate attempt to ruin the human population? Or maybe it's bioterrorism. What is this global infection and who is spreading it? Help us find out. Go to Amazon and search for The Outbreak of a Monstrous Infection. The human race needs your help to make this go viral. Go to Amazon.com and read The Outbreak of a Monstrous Infection to find out what happens next. Go now! The world is depending on you.
And now, back to Dr. Afshan Hashmi's radio show.
Now, friends, I will read my thoughts on this beautiful book. And here I go. And this is my review. One of the most interesting books I have read. Dr. Gottlieb provides a history that is wholly apolitical of what went wrong and why it went that way. Dr. Gottlieb goes through each major issue in the pandemic, testing, non pharmaceutical interventions, therapeutics, and vaccines, and discusses why they were implemented and what needs to change to improve our response to the next pandemic. An utterly fascinating read. I give this book 5 out of 5 stars. So, this was, friends, my review of this beautiful book. And now I will read. And before that, I will say that, friends, I review books and I have reviewed thousands of books. So, if you have a book, a paper, or uh, any of the products, cosmetics, makeup products, or film or TV serial, then you can write to me at Afshan at drafshanhashmi.com, and I review it on this show on a very reasonable price. So please write to me at Afshan at drafshanhashmi.com, and I will be looking forward for your emails and all. And I am also in conversation with many of the authors and entrepreneurs on this show, and movie directors. So you can write to me at Afshan at drafshanhashmi.com. Or also, one request I have to make: this book, The Outbreak of a Monstrous Infection, will be a very good movie material or TV series material, and I'm looking for some producer or director to contact me at Afshan at Afshan Hashmi if you are interested. All those Hollywood, Bollywood, Netflix, Amazon producers and directors, please contact me, and we will go from there. Having said that, friends, now I will read little bit more from the book. And this is the chapter 3, and it says pandemics as national security threats. We needed to get boots on the ground. By late January, US officials were mounting a full court press for China to let staff from the CDC enter Wuhan. Chinese officials initially balked, then promised exits, stalled, refused, and finally relented after it was almost too late to do the CDC much good. China's willingness to sidestep some of the key commitments made as part of global agreements that were implemented after SARS 1 was felt viscerally at the CDC, which couldn't get permission from the Chinese government to let any of the dozen CDC staff permanently stationed in Beijing to visit Wuhan. The CDC had been trying to get access to Wuhan for more than a month with no success. On December 31, Dr. Anne Shushat, the CDC's top career official, was one of the first officials at the agency to spot the threat. She read a brief report in a scientific bulletin that tracks outbreaks, a description of 4 cases of unexplained pneumonia in Wuhan, and emailed a group of CDC colleagues asking if any of your folks know more about the unknown pneumonia in Wuhan. Within hours, an email reply came from Dr. Nancy Mess Norier, the director of the CDC's National Center for Immunization and Respiratory Diseases, who wrote that she learned there were actually now 27 patients with pneumonia. The characterization of the cases, she said, raises concerns about SARS. And so this was little bit from chapter 3, and I wanted to say here that I review books for this program, but this book which I am reviewing now in the program is not a sponsored review. I usually, if I like a book, I come here and review it, and whether it is a sponsored review or not a sponsored review, I always give my honest thoughts in every review. And I have reviewed thousands of books, makeup products, and movies, and TV serials. So, all those producers and everyone listening and authors listening, you can write to me at Afshan at drafshanhashmi.com. And now I will read little bit from, and I will give you a very, very reasonable price. And now I will read little bit from chapter 4. Chapter 4, the out, and here it is. The outbreak we didn't want to see. A 35-year-old man showed up at an urgent care clinic in Squamish County, Washington on January 19 with a persistent cold and a fever of 99 degrees. He had returned to the United States 4 days earlier after traveling to visit his family in Wuhan and saw a health alert from the CDC about the novel coronavirus outbreak in China. Because of his symptoms and his travel, he decided to see a doctor. A rapid flu test came back negative, and his recent travel history made his doctors immediately concerned that it could be coronavirus. His doctor alerted the Washington State Health Department, which in turn contacted the CDC's Emergency Operations Center, the only place in America where a patient could get tested for the novel coronavirus. At that point, the CDC was tightly rationing who received a test because it had the capacity only to run a small number of tests a day in its lab in Atlanta. The man's travel history meant that he met the CDC's tight fisted testing criteria. After his doctors collected two specimens from his nasopharynx, he was sent home to wait in isolation with his quarantine closely monitored by the local health department. On January 20, the CDC confirmed that he had the virus. He was transported from his home to Providence Regional Medical Center in Everett, Washington, where he was admitted to a special two-bed biocontainment ward that had been established to handle Ebola patients. For a time, he was the only known person in the US infected with the novel coronavirus. He would also be the first coronavirus patient to receive the experimental drug remdesivir. A total of 50 people with whom he had close contact were also tested and put into quarantine, but none of them ended up developing the infection. For now, health officials thought they had managed to contain the first known introduction of the virus that had shut down the city of Wuhan. However, back in Washington, D.C., some White House officials had growing concern that we wouldn't be able to contain it for much longer. A week later, in an Oval Office meeting on January 28, National Security Advisor Robert O'Brien told President Trump, "This will be the biggest national security threat you face in your presidency. This is going to be the roughest thing you face." Matthew Pottinger, O'Brien's deputy, had reached the same conclusion. 2 days earlier, Pottinger had sent an email to White House staff asking whether the US should immediately halt all travel from China. "The situation in China is clearly out of hand," he wrote. Pottinger had an undergraduate degree in Chinese study and was fluent in Mandarin. He had worked as a journalist for 7 years reporting from China for the Wall Street Journal before he joined the United States Marines as a military intelligence officer. He served all four national security advisors during the Trump administration, eventually being tapped as Deputy National Security Advisor by O'Brien in September 2019. Pottinger was well placed on this issue. He still had sources on the ground in China with whom he stayed in touch, and his wife is a virologist who had worked on HIV for many years in the CDC's global branch. Moreover, Pottinger's older brother was an infectious disease doctor at the University of Washington. Pottinger had covered the 2003 SARS-1 epidemic for the Wall Street Journal and had seen firsthand the Chinese government's effort to conceal its spread. In fact, it was his reporting that broke the story despite China's initial denial that there were cases of SARS-1 spreading in the northern parts of the country, even though SARS-1 was largely confined to a handful of regions. It had wrought havoc in some of the world's financial capitals. It was proof of the kind of severe economic and social dislocation that a dangerous epidemic could cause. The new coronavirus looked as if it could be an order of magnitude worse. It had potential, very worried. So this was, I was reading from chapter 4, and now chapter 5, and here it is, and I'll read little bit from chapter 5. Looking for a spread in the wrong places. A pivotal moment occurred at the January 21 Coronavirus Task Force meeting in the White House Situation Room. Joe Grogan was passing hard on whether the coronavirus could be spreading without being detected. Secretary Azar turned to Anthony Fauci to address Grogan's concern. What would be the epidemiology to justify your question? Fauci pointedly asked Grogan. Fauci was technically correct. They had no epidemiological data to prove that community spread was underway. But why was that? Because of the CDC's failure to deploy diagnostic testing that would have shown community transmission was happening. Against the backdrop of the events unfolding around the world and the cases that were starting to emerge in the US, fear among some White House staff was growing. Grogan, Pottinger, and others started to become very concerned that we could be missing a lot of infections. So, this was the read and review of this beautiful book. And now, friends, I will sign off from this episode of W4WN Radio and Talk for TV, and see you tomorrow, Thursday, on Hollywood Radio or K4HD Radio and Talk for TV with another review of a beautiful book. And also, friends, if you want the review of your books, or if you want to give me sponsorship or review of your makeup, cosmetics, or film, or movies, or makeup products, cosmetic products, or TV serials, then you can write to me at Afshan at drafshanhashmi.com. And now I will sign off from this beautiful episode. And cheers and bye bye.
You have been listening to Dr. Afshan Hashmi's radio show on W4WN Radio, the Women for Women Network. Tune in live right here every Wednesday at 6 p.m. Eastern Time. Would you love exposure for your business, product, or service to over 300 million potential listeners? Send an email at info@talk4media.com. And remember, if you missed any part of this show or want to hear it again, find our featured show on iHeartRadio, where all past episodes are available on demand 24/7. See you next Wednesday at 6 p.m. Eastern Time.